programs we run is on the right to health. Over the past couple of years, we've been doing a lot of work on issues around universal health coverage. One, we do a lot of work on budget advocacy, budget monitoring, as well as advocating for increased resource allocation to the health sector. We also done a lot of work around the health insurance program. We did some work around advocacy for the current law now, which makes health insurance mandatory for all. And now the law is there. We are also working in collaboration with the National Health Insurance Authority to see how that law can be implemented, because it's getting to 2 years now. They now have an operating manual, but unfortunately or fortunately, the executive secretary have been removed after the launch of the operating manual in, I think, late November or late December last year. And so I think they're still trying to get their acts together. And we are highly of the opinion that the resources available to the state, to government, federal government and state government may be little compared to what will actually come into for the health sector if we have a properly implemented mandatory health insurance program. This year we are talking about 1.3 trillion at the federal level. If you include all that the states give, maybe it may not be more than 2.6 or 3 trillion. But we are of the firm conviction that if you have this mandatory health insurance implemented, we could possibly talk about extra 4 to 5 trillion in premiums every year that could also facilitate health service delivery, because Nigeria has one of the highest out-of-pocket health expenditures in the world, which is quite troubling. Now, beyond that, we have this idea of a bill for the Health Development Bank. And the idea is that in sectors like agriculture, despite the budgetary allocations, there are all kinds of, we have the Bank of Agriculture, we have all kinds of funds, like in the previous administration. The former CBN governor made provisions for the Anchor Borrowers Program and a number of other funds. Yet a new law has just been passed also for, I think it's Agricultural Development Fund also, which is still more resources. And considering the health sector that needs quite a lot of resources, we thought that it is imperative that a bill or a new law be enacted to provide for the equivalent of the Bank of Agriculture, Bank of Industry for the sector, so that once that investment is made by the government at the first time, it will become revolving. It's not like they're going to charge purely commercial interest of 20-something or 30%, but even if it's single digit, it will allow them to recover their costs and recover the money, and then continue to support the sector in improving infrastructure, or even some level of medical research, or even the pharmaceutical sector, helping the pharmaceutical industries to become more self-reliant and to be more productive for the economy. So that's why we crafted this draft bill, and we know on our own that we are not going to be the ones to push it in Parliament, that we bring the idea and then talk to elected representatives in the National Assembly, talk to the people in the Ministry of Health, and see how they buy into the idea and the possibility of somebody in the legislature being the sponsor of this bill if it's something that he or she believes in. And what we've crafted is not cast in stone. These are own ideas, and of course anybody who takes it up will also make inputs, and even executive bills don't come out of the National Assembly the way they were presented. So whatever we have there is like setting the ball rolling so that other authorities and individuals can now fine-tune and take it to the finishing line. So that's why we came to see you, and to see the possibility of collaborating with you and the committee to be able to get this.
Please go on, I'm listening.
Okay.
I'm with you.
To be able to get this.
Please go on.
To be able to get this gazetted as a bill in the National Assembly and the possibility of pushing it forward further. What we have done with this bill is that we model it after other development banks. We are looking at a share capital that will be subscribed to by the federal government and possibly international development banks, and we expect that they will be rendering their credit services not just on a purely commercial rate, but at a rate which will allow them to recover and have more resources to be able to give to other persons. What we propose here in terms of where the resources will be invested, we talked about reference hospitals and highly efficient monospecialty hospitals. We talked about laboratories, diagnostics equipment. We talked about information and communications technology, manufacture and production of vaccines, local manufacturing of health devices and commodities, and quite a number of other things. So that's the idea. And learning from the lessons of other development banks, structuring it in such a way that it will be successful, and at the end of the day, more resources will be available. And the whole beauty of this is that if somebody gets money and is a real professional in the sector, is an investor in the sector, and you know you are going to pay back, so you are going to run it more proficiently than simply people who see public money, because public money sometimes people look at it as a gift or something that you're not supposed to properly account for or manage, unfortunately. But that's what happens in our sector today. So
please go on, guys.
Beyond this, we are also worried that the basic healthcare provision fund, for instance, has not been properly managed and run. The 2014 National Health Act makes it a statutory transfer, it's first line charge. Now, I think the first monies were released to that fund around 2018. Even since then, it's been like epileptic. That the last time we had a workshop, somebody from the Ministerial Oversight Committee came and said there was only 17-point-something% utilization. And it appears the money is not usually rolled over. If it is brought, for instance, in 2022, they said there was no release. If it's brought in 2023, maybe if for any reason something happens, it appears when the Accountant General is circulating his circular towards the end of the year, it's like the money gets mopped up. But these indicators, maternal and child health indicators, are depreciating every day. So I ask myself, where will there be money there? And then people who are supposed to utilize it are not getting access. Women are dying in childbirth, children are dying from immunization preventable diseases, and the resources are there and nothing is happening. The full money is not released. The one that is released is not properly utilized or implemented. So we also think that committees like chaos relating to health should be able to use their oversight functions and powers to ask critical questions. Why do we have people not having access to healthcare when the resources are there? What is happening? What are the protocols? What are the bureaucratic formalities, red tapes? We should be able to cut it and let people benefit from these resources. And finally, sir, we also have it on good authority that even the people who are on the lists as beneficiaries of the Basic Healthcare Provision Fund, that is somehow linked to the social register, which has been much maligned. And people who have been there before as executive secretaries of state health insurance agencies, some of them I spoke to told me that in some of their states, that the actual people who are indigent, who are supposed to be on that list, is less than 40-50%. And the other people on the list are not qualified to be there, but the political...
Which fund is that?
Basic Healthcare Provision Fund.
Do they give it to individuals?
The money comes from, you appropriate it here,
Yes.
1% CRF.
It's supposed to be first line.
Yes. Then it gets to
the states.
It gets through two or three windows. Ministry of National Health Insurance Authority,
Yes.
Primary Health Care. Now it gets to the states,
Yes.
right?
Yes.
The states are supposed to keep the list because it's supposed to be for the indigent and the vulnerable.
They give them money?
No. They benefit. They put them on a register as people who will go to the hospital free of charge.
Not pay.
Yeah, who will go to the hospital free of charge.
Yes, sir.
So I'm linking it to the social register because it's also linked to that register in terms of the benchmarks of people being on the first register. Somehow informs.
Well, let's leave that because
okay.
I'll be leaving about 3. I have a committee meeting.
All right.
It's okay. Please round up.
Okay. Let me stop here, but at least more emphasis on the bill which I will present to you.
So thank you very much.